Pneumonia and respiratory syncytial virus, RSV, are both respiratory conditions known for affecting the lungs, but they differ in causes and populations they typically affect. Pneumonia is characterized by symptoms including a deep cough, often producing phlegm, fever, chills, and difficulty breathing, while RSV tends to manifest as a mild cold-like illness in adults but can cause more respiratory issues in infants and young children. Treatment for pneumonia often involves antibiotics if the cause is bacterial, rest, and fluids, while RSV usually requires supportive care like hydration and fever management, with hospitalization for severe cases. Risk factors for pneumonia include being very young or elderly, having a compromised immune system, or suffering from chronic diseases, whereas RSV risk is highest in premature infants, the elderly, and individuals with heart or lung diseases or weakened immune systems. Here's detailed aspects of both diseases for a better understanding of their differences and similarities. Affected lung areas, alveoli versus bronchi. Pneumonia primarily targets the alveoli, the tiny air sacs in the lungs where oxygen and carbon dioxide exchange occurs. The infection can lead to the alveoli filling with pus or fluid, making breathing difficult and reducing oxygen intake. It can be caused by various pathogens, including bacteria, viruses, and fungi. On the other hand, respiratory syncytial virus, RSV, affects the bronchi, the main passageways into the lungs. RSV typically causes bronchiolitis, an inflammation that leads to congestion and wheezing, particularly dangerous in infants and young children. The difference in affected lung areas can influence symptoms, treatment approaches, and patient vulnerability. Nature of cough: productive with potential consolidation versus often productive without consolidation. When distinguishing between pneumonia and respiratory syncytial virus, RSV, based on the cough, there are notable differences to consider. Pneumonia often presents with a cough that can be productive, meaning it's accompanied by phlegm, which could indicate lung consolidation, where the lung tissue becomes firm and loses its spongy texture due to the accumulation of fluid and infection-related cells. On the other hand, while RSV can also manifest with a productive cough, it's typically less likely to be associated with consolidation. Instead, RSV affects the bronchioles, leading to inflammation and mucus production without necessarily causing the lung tissue consolidation characteristic of pneumonia. Recognizing these subtle clinical variations is crucial for healthcare professionals in the accurate diagnosis and management of these respiratory conditions. Duration of illness: acute or prolonged versus generally more acute. Pneumonia and respiratory syncytial virus, RSV, both affect the lungs but differ markedly in the duration of the illness they cause. Pneumonia, particularly when caused by bacteria, may present as a prolonged illness, with symptoms like cough, fever, and difficulty breathing lingering for weeks, often requiring antibiotics for resolution. In contrast, RSV tends to cause more acute but self-limiting symptoms. Although notorious for severe infections in infants, it generally results in a quicker recovery, barring complications. For adults, it's often akin to a cold. Careful monitoring is essential, as both can lead to serious complications, particularly in vulnerable populations. Typical auscultation findings: Crackles or Rales versus Wheezing or Rhonchi. Pneumonia and respiratory syncytial virus, RSV, present distinct auscultation findings that can aid in their differentiation. Pneumonia, often caused by bacterial or viral infection, can lead to the accumulation of fluid and pus in the lung alveoli, generating crackles or rales, a series of short, explosive sounds during inhalation. These sounds are typically localized to the area of the lung involved. On the other hand, RSV, a common respiratory virus, targets the bronchioles, which can cause inflammation and airway narrowing. This results in wheezing, a high-pitched whistling sound heard primarily during exhalation, or Rhonchi, which are low-pitched sounds resembling snoring or rattle, indicating the presence of mucus in the larger airways. Both these sounds tend to be more widespread and can vary with coughing. Recognizing these auditory clues facilitates prompt and accurate treatment, hence improving patient outcomes. Associated symptoms: systemic fever, chills, versus primarily respiratory symptoms. When differentiating between pneumonia and respiratory syncytial virus, RSV infection, Systemic symptoms like high-grade fever and chills can be more pronounced in pneumonia. Patients with pneumonia often exhibit these symptoms due to the infection and inflammation in the lung tissue, which can trigger a strong immune response. In contrast, RSV tends to primarily present with respiratory symptoms, especially in children. It can cause coughing, wheezing, and difficulty breathing. Although RSV can also cause fever, it is generally lower grade and not as prominent as the respiratory distress it triggers. In severe cases, or in vulnerable populations such as infants or the elderly, RSV can lead to serious conditions like bronchiolitis or pneumonia, complicating the clinical picture.